Tonight, local pediatricians say they are gearing up, hoping to prevent an outbreak of measles here in North Carolina.
It comes as the CDC reports a couple hundred cases in the U.S. so far this year. States like Texas, where at least 2 people have died. CBS 17's Mariah Ellis joins us live. And Mariah, doctors you spoke with say most of North Carolina's counties could be vulnerable.
Yeah, that's right. Dr. Pamar with Cornerstone Pediatrics in Cary says in about 20 years of working with patients, she has not seen a single case of measles in her clinic. But she says in an area where we see a lot of travel, especially areas with lower vaccination rates, she says it creates a higher risk. A virus highly contagious, putting our youngest most at risk.
Which kids were infected most recently and around the world? It's between ages of 1 and 4. Who's at risk? Unvaccinated.
Dr. Shafali Pramar is the lead pediatrician at Cary's Cornerstone Pediatrics. She says measles spreading across places like West Texas and New Mexico with more than 250 people infected, cases now reported in at least 12 states, is sparking concern.
Measles is one of the most contagious viruses in the world. It is a virus that spread from person to person, can live in the air for several hours. So when the vaccination rates drop and you get a measles case, unfortunately, it just spreads like a wildfire.
Pramar says 2 doses of the MMR vaccine, a live virus vaccine triggering antibodies, is 97% effective, helping prevent symptoms ranging in everything from rash, cough, fever, and runny nose to pneumonia, brain swelling, and even death. She says there's a reason their clinic is monitoring it closely.
We need to understand that we remain vulnerable. Why do we remain vulnerable? Our vaccination rates in this particular state have also dropped.
Pramar says nearly 70 counties in North Carolina are sitting below the herd immunity threshold, meaning children in these communities going to kindergarten with a vaccine has dropped below 95%.
The death rate is 1 in 1,000. And we've already had 2 deaths. Knowing, the current count, official count, is maybe close to 300 right now cases in the U.S. We know that that count is likely underrepresenting the actual number.
With higher exemption rates and high travel in North Carolina, health experts believe an outbreak is only a matter of time. Now, doctors also say that North Carolina has not had a reported case of the measles since September. That was back in 2024, just last year. But they said they are definitely keeping an eye on some of these cases. Unfortunately, they said that they are really just kind of monitoring and making sure, again, that people continue to be educated. Mariah Ellis, CBS 17 News.
All right, Mariah, thank you.